Hi, I'm Dr. Datis Kharrazian. I want to talk to you about the information that we're going to be covering in the Kharrazian Institute course on infertility, prenatal, and maternal health. The big thing to really understand about infertility and prenatal care and maternal health is really what's involved. So what I'm going to do is I'm going to do an extensive review of the literature for you and share with you how various factors are involved through diet, nutrition, lifestyle that really impair the woman's ability to become pregnant, to maintain a pregnancy, also to have healthy fetal development, and also to avoid complications that take place with postpartum conditions. Now, when you look at infertility, infertility is not simply just a hormone imbalance. One of the things that we've really learned with the latest research is that fertility and the ability to have normal menstrual cycles and to maintain a pregnancy really involves integration of pathways involving blood sugar stability, thyroid function, adrenal gland function. The microbiome plays a big role. Hepatic biotransformation is really critical. Environmental factors that can play a role, the role of the gut in transferring metabolites into hormones, the role of the gut to get rid of chemicals, the role of prostaglandins in impacting hormone receptor sites. There's a whole cluster of physiological mechanisms that are really involved with the so-called physiological web of mechanisms that really allow for healthy pregnancy to take place. So in this course, I'm going to show you all the research, I'm going to connect all the dots for you, but more importantly, I'm going to give you a clinical step-by-step approach so you know exactly what to do and how to evaluate a patient that's struggling for infertility. Really, when you look at infertility, there's really different degrees of management. The basic level of management is you have a woman who maybe has abnormal cycles or has lost her cycles, and then you try to improve their health so they can have normal, regular cycles. And then if you go a little bit past that, the next level is just to make sure that a woman has a healthy follicle. And then if you go past that, the key thing is to really make sure that a woman has the ability to really maintain the pregnancy and avoid things like miscarriages. And that's like basic level of infertility management. But really, management has to go much deeper than that to really be clinically effective. As a clinician, you really want to look at all the risk factors that can impact fetal health. We know that conditions like autism or learning developmental disorders or childhood allergies can be dramatically influenced by the health of the mother throughout their pregnancy. So not only do we want to make sure that a female that's struggling from infertility can get pregnant, but we also want to make sure that we remove risk factors that can optimize or risk factors that can get in the way of a child's development and healthy development. And then the next thing is really going a little bit deeper past that, is making sure that a pregnant woman really has the ability to not develop postpartum conditions, whether it's complete dysfunction of their metabolism, depression, mood disorders, and so forth. So in the upcoming course, I'm going to share with you all the literature. I'm going to show you how to go into the depth with all these different levels of management, and then I'm going to put this all together for you with all the latest research and show you clinical applications using diet, nutrition, and lifestyle, as well as share with you some clinical cases from my own practice. I hope you get a chance to look into the course, and thank you for your attention.